My name is Brady Kirkman, Executive Director of Marketing and Business Development here on The Pulse. And today we're back with none other than Kim Armstrong. Hello, Kim. How are you?
Hi, Brady. I'm well. Thank you.
Fabulous. Well, thank you for being on The Pulse today. We want to talk a little bit about what your role is here at Windom Area Health.
Sure. I'm the patient financial counselor in the billing department. And we have billers that get the billing done and get those out the door. My role is more after the billing cycle when the accounts turn to self-pay. And so I contact patients and let them know that their bill is due or that they have a balance. I work with them on payment plans. If people have concerns or are not able to meet our payment plan guidelines, I talk to them about financial assistance. And I also work with Windom Area Health has contracted with a company called Elevate. And so if you come to our hospital and you don't have any insurance, we mark you as a self-pay, and someone from Elevate will contact you and they can do a quick screening to see if you qualify for Medicaid, or they can see if there are other insurance options for you.
Well, we're always talking about touchpoint standards and how important it is that you get the best care, at Windom Area Health. And it really follows after the services as well, is making sure that you understand your bill and your statements. And I think it's safe to say that we always encourage patients, if they're unsure of what their insurance covers, to call your insurance company and check that out. Talk to us a little bit in layman terms. What is it, that you really do for patients? I know they always say that we have billers and we have, patient counselors. What is your direct role that can help make that process easier for patients?
Well, if someone gets their billing is complex. There's no question about that. And so if you're not understanding, what the deductible is or how that processes, the billing line is the best line to get the biller who knows the exact specifics of that.
And that number is?
It's 831-0616. If you have concerns about your bill, if you're worried about the payments or that the payments are large, that's when it rolls to me. And then I can tell you about our financial assistance program, what's required. You can come in. I can go through the application, sit down with you, and do the application with you. And then, like I said, set you up on a payment plan that we have guidelines we have to follow, but hopefully something that's affordable.
Well, and we know that your time as patients is valuable, and we want to respect that. So it's best that they actually schedule a time to meet with you, so that way they're not having to wait long periods of time.
Right. I go down to the ER. I go to see inpatients at times, and so I'm not always readily available. But if you call or send me an email, we can set up an appointment, and we'll make the best use of your time.
And you talked about those different payment plans. What other suggestions or advice would you like to share with the patient?
Like I said, I know that it's complicated. Sometimes you're looking for a bill and one's not coming in the mail, that you may be set up on paperless billing, and we can turn that off if that's something that you'd rather have. But basically, if you have a question, we're here to help you through that, and please give us a call.
And one more time, the full number that they can get a hold of you at?
507-831-0616 is the billing line. And then my direct line is 507-831-0615.
Perfect. Well, Kim, I appreciate you being on The Pulse today and sharing a little bit more about this with the patients. We'll see you next time.